Okay, hi guys! We are meeting doctor for the first time. Finally getting my freaking surgery. Hi doctor, how are you?
Nice to meet you.
So tell me what's going to happen.
So, I believe you're interested in lower blepharoplasty because of mainly genetic under eye bags.
Yeah.
And, have you ever had anything done to your lower eyelids before?
Yes, I've had two like tear trough fillers,
Okay.
PRP injections consistently,
Okay.
micro needling, like tretinoin and the whole
Okay.
nine, yeah.
So none of those things do anything with the actual fat bags, and in fact, fillers just make things worse.
Okay.
I have a publication that talks about this. So what we want to do is properly
Wait, one
done-
second. I saw that you teach at UCLA.
Yes, I do.
Did you go there?
Yes.
I'm a Bruin,
Wow.
and my mommy's a Bruin.
That's
Yay,
awesome.
Bruin.
So as far as what we want to do is a properly done lower blepharoplasty, which
Okay.
means we want to keep your eye shape function the same. We want to have youthful, natural results.
Okay.
So technique is important.
Okay.
When I'm doing the lower blepharoplasty, in your case you're young, we don't need to remove any skin.
Okay.
This is going to be a scarless technique with incisions on the inside of the lower eyelid.
Okay.
It actually heals very fast, it's scarless, it's a painless recovery.
Okay.
What we want to do is remove and shift the eye fats that you have, so again the under eye becomes more smooth and you look more refreshed, again with natural results. You want to keep the eye shape function the same.
So when you remove them, so you're not just taking them out and like throwing them away.
Every case is a bit different, depends how much eye fat you have and also how much wholeness you have around it. So the ratio of how much I remove and shift differs on each patient.
So I've also seen, and I think you do it as well, it's like CO2 laser or something afterwards. So what's the deal with that?
CO2 laser, first of all, you don't need that. That's for the skin itself.
Yeah.
Right? So your skin is not the issue here. What's the issue is the puffiness. It's the bags.
Well, after I did filler, I've also done carboxynol therapy, but after I've done that, I feel like my skin is crepey when I smile, and I hate that. Like, it's too like wrinkly. So I thought the CO2 would help to kind of like tighten the skin.
It's not going to do as much as, so when you're smiling, the muscle contracts and the skin bunches. So
yeah.
laser resurfacing can help a little bit, but not as much as you think. I would leave that for future reference.
Okay.
Especially with your skin type, you want to be careful. And me personally, I wouldn't do the CO2 laser. I would have you see an expert who really deals with your type of skin.
Okay.
Because there are other prep work you got to do. But
Okay.
as far as the lower blepharoplasty, doesn't matter you're a man, woman, white, black, Asian, the same exact procedure. Again,
Okay.
scarless technique going from the inside, quick recovery.
Okay, so I know we've also talked about local anesthesia versus general anesthesia.
Good question. So there are actually three types of anesthesia.
Yeah.
One, general anesthesia, IV sedation, local anesthesia.
Okay.
What most surgeons love to use is general anesthesia, but it's technically unhealthy, and for this procedure, in my hands, it's overkill. So
Ooh.
the two choices I give patients is either IV sedation, if they want to be out of it,
Okay.
or local anesthesia.
Okay.
IV sedation is done with the anesthesiologist. For all essential purposes, you sleep, but you're breathing on your own. It has a quick recovery once you turn off the IV. So if you want to be out of it, you pick IV sedation. What a lot of my patients also choose is local anesthesia. This way, there is no anesthesiologist. We give you a Xanax pill and a pain medication. You become more relaxed, but you technically still awake. The only part you're gonna feel is the numbing part. It burns for about 20 seconds. After that, you're numb, you won't feel anything, and your eyes are closed, you don't see anything.
Oh.
It's easier way to schedule the procedure and less expensive. But we always give the choice to the patient anyway, local anesthesia versus IV sedation.
About how long does it take from start to finish?
The actual procedure is about 35 to 45 minutes.
Oh.
That includes the numbing part and prep work.
Okay. And so earlier when you mentioned moving so this is a fat bag. Wait,
Correct.
let me start.
Yeah, so I'll demonstrate. This is the fat bags. Now, right above it, right here,
Mhm.
this is muscle. This is youthful, that stays. What we want to get rid of is this right here. Again, we want to keep the eye shape function the same.
Yeah, I see that. Oh God, that's terrible. So this is going to be gone like this.
Correct. And you know, again, in your case, it's a lot of it is genetic. Sure, it's a little bit age-related as well, but most of it in your case is genetic.
Okay, and then another question is, will this come back?
No, definitely not to this extent. Let's put it a different way.
To this extent.
It will not. It won't. If it comes back, it won't be as much as what you have now. Meaning, most people don't have to do this again. So usually this is just a one-time thing. But if you're gonna do it, it's 20 years from now.
Okay, so why would it come back?
Because in the eye socket, the eye is surrounded by fat. And based on aging, some of this fat can come forward. That's why you can get more bags as you age. But again, because we're doing the surgery, most likely, let's go with percentage. 95%, that's it. You don't have to do this again.
Cool. And then is there anything that I could do afterwards to help like maintain my results or just, you know, good practice?
No, nothing. Just be healthy and don't do fillers or something else that's going to cause trauma to the area. If you cause trauma to the area, then the tissues can get loose and again, things can change.
For how long?
No,
forever?
You should ask, yeah.
So PRP injections, for example?
I'm okay with PRP injections.
Okay.
I don't know exactly how much they do, but it's okay if you want to do.
But just not filler. Botox?
Botox is fine. Filler is fine. Like
you say no filler.
I don't like under eye fillers. In general, there are always exceptions, but in general, I don't like under eye fillers.
Okay, I agree. It kind of sucks.
Yeah.
Okay, I feel like that's cool then.
And we might have to actually dissolve the filler that you already have right before surgery.
Can you believe this man? But I mean, how would you even know if it's still there? This was from years ago.
Because fillers under the eyes last many years, and the reason to dissolve them is you're gonna have more swelling after surgery if there are fillers there. So that's the reason we want to dissolve it.
Okay. So are you gonna do like a scan to see where it is and then dissolve it, or you just?
I already just the area that filler is. I just that's the area I'm gonna dissolve. We don't have to do any scan.
Okay, and then I know that you said you're gonna go in through the lid to take the bag out. Are you using any like little microscopic camera to see where the fat bag is, or are you just poking around in there?
No, I'm looking at it. This is a direct visualization. As soon as you see it.
Okay. So
there are videos on my website. You can actually see the surgery, see the fat bags.
So after you take it out, how are you going to then position it downwards?
You make a dissection, you make a pocket, and you shift the fat there, and you suture it in place.
So will I have a scar here where you put it down?
No, the cut is on the inside.
Okay. All right. I feel like I'm good then. Do you have any questions for me? Because I feel like I'm ready for this bad boy.
No, I think you know a lot about this already. You're gonna be happy and confident.
Yay! I'm so excited. Everyone's so excited. We're all just so freaking excited. I'm gonna look. Oh wait, another question. How long for recovery?
So recovery is painless.
Okay.
Vision, the first day is not good. The next day is fine. You can do reading, computer work the next day.
Okay.
No exercising for 1 week.
Okay.
And yes, you will have bruising, swelling. That's obvious. Most people can cover it after about 10 days.
Okay, so 1 week, no workout, about 2 days for like eyesight. So that means after
the first day your sight is not great. The next day should be fine.
Okay, which means I will need someone to drive me home.
That would be ideal.
Oh,
yes.
and then when is the Xanax gonna like wear off?
It's not half a day.
Okay. Alright, I feel like that's cool then. Side effects.
So most of the side effects have to do with technique. So when you see eye shape changes, lower eyelids getting pulled down, scarring, those all have to do with technique that goes from the outside in versus the inside.
Okay.
So we avoid those complications. That's why you want to have an expert when you're doing this procedure.
Okay. Oh yeah, and can you also tell them your specialty, like your field or specialty?
I'm an oculoplastic surgeon, which means I specialize in eye plastic surgery, which is really just this area.
Okay, loves it. And then another thing, when I was filling out my intake, there was a question about family history. So both of my grandparents suffer from glaucoma.
It wouldn't matter here.
Okay, cool.
Yeah.
Okay, cool. Alrighty then.
excited.
We're scheduled in a few weeks. When are we scheduled? Do you know when we're scheduled?
My assistant will help out with that.
Okay, so just met with doctor for the first time, and it was actually really cool. Like, he was super cool, super calm. Like, he has like very like calm demeanor, which I can appreciate, because I'm like, you know, and he's just like very chill, very mellow, very calm, which I definitely did love. He really seems knowledgeable. Obviously, that's why I'm coming to him, because he is, I think, knowledgeable, but he really does seem knowledgeable. He seems extremely confident in what he does, which is really helpful for me, because this is like a big deal. Like, I think anything on your face, let alone on your eyes, is like a really big deal. So yeah, oh my god, look at all of his whoa, these are like all of his awards and like certificates and stuff. That's so freaking cool. And the fact that he's a Bruin, like, I don't care about what y'all gotta say. Anyone that's a Bruin, 10 out of 10, automatically trust them. Like, automatically trust them. But I'm just super excited. I feel like this is going to change my life. Like, I really feel like this surgery is going to change my life. And I have been dealing with this since I was a kid. I don't know which one of my parents gave this shit to me, but yeah, I've been dealing with this since I was a kid, and like, I'm just tired of looking tired. I'm tired of always being asked if I got enough sleep and stuff. So yeah, let's knock this out, because this is crazy. It's crazy.